We reported earlier this month about significant declines in college enrollment. We now have a new report about what's pushing current students to rethink their time in school. Gallup surveyed 12,000 students, and the top two reasons undergrads last year considered pausing their education were for emotional stress and personal mental health. Emotional stress and mental health are also among the top reasons some adults never enrolled at all. Joining us now is Dr. Jessi Gold. She's an assistant professor in the Department of Psychiatry at Washington University. Doctor, what are the biggest causes for this emotional stress for students?
I think people forget that college students have always been stressed, and it's definitely a time period of transition. You go from maybe living at home to living with people all the time, eating with people, sleeping with people. It's a big time of identity development, and it's also a big time for experimentation with substances. If you add on to that what the pandemic has done, which has created a lot of social isolation, has really distorted that image of what college was supposed to be for people as they're doing it online, and has made that really different for socializing and making connections. I think all of that compounds to be where we are right now with their mental health.
The Gallup report says 47% of female students experience emotional stress compared to 30% of males. How do you hear those numbers? What do you think accounts for that?
We often see higher numbers in women for all things mental health. It's hard to exactly pinpoint why. Some people might point to the rise of social media and the impact on self-esteem, and some of those numbers tend to impact females more. If you look at the recent CDC data for young girls and suicide, a lot of the data suggests that there's a lot of trauma in women, and you'd imagine that's contributing. And maybe it's just the way that we express and feel emotions differently, and maybe we process with groups, and maybe that men don't, and maybe that leads to different numbers in the way that we're testing and measuring this. But either way, I think it's really important to have targeted interventions and make sure that kids are getting treated when they need to be.
And speaking about targeted interventions, how should parents think through the decision process if their child comes to them and saying that they want to take time off? Should parents always say yes, of course, or is there a decision tree you should run through when you're thinking about these things as a parent?
I think it's really hard as a parent not to immediately freak out if you hear your kid say that they don't want to go to school anymore. That's a huge decision. You have to realize that emotions impacting that decision might mean that their head is not clear and immediately making that choice for the long term. You want to be there, support them, listen, not immediately leap to action and change things. Try to figure out what you can do to help in the interim. Maybe they just need to take a less of a course load and have mental health treatment. Work out the options with them if they want it. Make sure you're always checking on them and really validating their experience along the way.
Great advice as a parent of college kids. Dr. Jessi Gold, thank you so much.
Thanks for having me.